According to the CDC this weekend, there are now more than 7,500 confirmed cases of monkeypox in the U.S. with infections in all but 2 states, Montana and Wyoming. Joining us now to discuss viruses is global infectious disease expert Dr. Rajiv Fernando. Doctor, thank you so much for your time. Let's start with President Biden testing negative after his Rebound Covid case. Is he in the clear now?
Thank you so much for having me. And yes, once again, when you have a negative antigen test, you are clear. It means you're not shedding virus anymore. The White House is actually going to test him another time just to be on the safer side. But it's very important. We do know there's a lot of issues going on in the world. The president needs to get back to work, but we're cautiously following his health. So far, his symptoms are mild to moderate. And the reason the symptoms are very mild despite his age is he's gotten vaccinated. He's gotten a full series of vaccination, and he's got 2 booster doses as well. So these are some of the things that are keeping him out of the hospital. I'm glad to say he's feeling a lot better right now.
So what's your advice to anyone else who may get a rebound infection of COVID? Do they just continue isolating until they get that negative test result again?
Yeah, that's a great question. And the safest way to do things is really to have a negative antigen test. Now, Rebound Covid is uncommon, really. A patient placed on Paxlovid is a great drug. But once again, all antivirals, they develop resistance. Paxlovid is a drug it works just like HIV. It's what's called a protease inhibitor. So a protease inhibitor for HIV develops resistance. The same thing can happen with Paxlovid as well. So it's really important, even after you test negative with a repeat COVID test negative after taking Paxlovid, if you have rebound symptoms, definitely to get checked again. And if you're positive, to go back in isolation.
Let's turn to monkeypox now. It's been declared a public health emergency. But who should get the vaccine for this virus? Anyone? Or should that be something specifically for people who might be more at risk of infection?
That's a great question. And I feel it's very important. I've been asking for this for a while. The United States and actually finally declaring this a public health emergency. WHO called this a few weeks ago. And what this really does is it increases finances. So there's more funding towards monkeypox. We do know there's a big problem. Seems like deja vu with COVID-19 again. We do know that there are not enough tests out there. There's not enough vaccines out there. And of course, there's a therapy called TPOX. Many people are not able to get this. This is concerning for me because we have patients, let's say, for example, with very, very painful lesions. Patients with monkeypox often describe their lesions as, just glass cutting away on their skin. Very painful lesions. We know immune-compromised people, pregnant people. These are all candidates who should be getting this treatment, but it's not available. But I'm so glad with the declaration of this public health emergency, we should see a lot more positive moves. We need more vaccines. We need more medications. And of course, public tracing is very important as well.
Outside of vaccines, what's the best way to prevent further spread of monkeypox?
So what's really important is obviously to be cognizant that this can happen to anybody. Anybody through contact, with close contact, this can happen. We know bed linen, things of that, toys. We have to watch this very closely when kids go back to school. But to be really honest with you, we know more than 98% of cases around the world are in the MSM population. We know about 40% who have monkeypox is in the HIV population. So it's a very, very sensitive topic. And what my plan over here would really be to urge leaders in the LGBTQ community or in the gay community to come out and say, this is dangerous. To understand the risk. People with multiple sexual partners, they're at higher risk. So I'd also urge, in this current situation that we're in, I'd urge people, not to get new partners or to really be careful to know who you're with. It's a very sensitive topic. It feels like HIV/AIDS all over again from 1983. But in this situation, we've come a long way from then. We're still seeing places across America where a lot of the gay community is thinking this is like HIV all over again. But I really think it's time for leaders in the LGBTQ community, the gay community, really come out and say, listen, this is the risks. It's not a stigma. We have to break through with that and be very sensitive with delivering this kind of information. Vaccines, medications, they will all come, but they're not going to come soon enough. So I urge the leaders in this community to come forward.
Finally, I want to get your thoughts on one other virus, polio, because the CDC has sent a team to New York to investigate a case there involving an unvaccinated adult resident. Now, the state's health commissioner says that case could just be, quote, the tip of the iceberg. So how concerned should we be about this?
Well, I'm glad you brought this up, and just the fact that we're talking about 3 infectious diseases in a span of 5 minutes really tells us, and tells our viewers, that, you know, these infectious diseases are out there. And I think the first thing we have to do as the United States is to understand the world is so interconnected that, you know, one thing happening in another part of the world. So in one part of the world, if the kids aren't getting vaccinated, they come here, they can have polio. It's not uncommon. So it's very important with the U.S. to understand emerging and re-emerging infectious diseases is not South Africa's problem or any other country. It's our problem as well. So that's something that's important to know. And we need to make sure COVID-19, of course, during this whole period of chaos, many kids around the country have not gotten their vaccines. So it's really important. This really understates a very important public health message that we should be more careful and we should be following our kids better.
Some good advice. And the last thing we want to worry about, another virus. Infectious disease expert, Dr. Rajiv Fernando. Thank you so much for your time, sir.